Dry skin therapy cream is used as a moisturizer to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations, such as diaper rash and skin burns from radiation therapy. This cream contains substances that soften and moisturize the skin, decrease itching and flaking, and protect the skin against irritation, such as from wetness. Dry skin is caused by a loss of water in the upper layer of the skin, and this cream works by forming an oily layer on the top of the skin that traps water in the skin. It contains common emollients such as petrolatum, lanolin, mineral oil, and dimethicone, as well as humectants like glycerin, lecithin, and propylene glycol to draw water into the outer layer of the skin. This cream also has ingredients that soften the top layer of skin cells and help the dead skin cells fall off, keeping the skin hydrated, smoother, and softer. It is recommended to use this cream daily, as needed, and it is best applied after bathing or showering. Remember to use this product as directed, and some products may need to be primed before use. Be sure to shake the bottle well if the label indicates it needs to be shaken. Apply the cream to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on the product and your skin condition. If you're treating dry hands, you may need to apply the cream every time you wash your hands throughout the day. If you're using the cream to treat diaper rash, make sure to clean the diaper area well before applying the cream. And if you're using it to treat radiation skin burns, check with radiation personnel to see if your brand can be applied before radiation therapy. Remember to apply the cream only to the skin and avoid sensitive areas such as your eyes, inside your mouth/nose, and the vaginal/groin area, unless directed otherwise. Also, be sure to check the label for any areas or types of skin where you should not apply the product and consult your doctor or pharmacist for more details. For best results, use this cream regularly and remember that most moisturizers need water to work well. Apply the cream after bathing or showering while the skin is still damp. And for very dry skin, your doctor may instruct you to soak the area before using the product. Keep in mind that long, hot, or frequent bathing/washing can worsen dry skin. If your condition persists or worsens, or if you think you may have a serious medical problem, seek medical help right away. When using dry skin therapy cream, it is important to be aware of the potential side effects. While most people can use emollients safely and effectively, some may experience burning, stinging, redness, or irritation. If these effects persist or worsen, it is important to seek medical advice. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks. However, it is important to be vigilant for any unusual changes in the skin, signs of skin infection, or serious allergic reactions. These may include changes in skin texture, rash, itching, swelling, severe dizziness, or trouble breathing. If you experience any of these symptoms, seek medical help immediately. It is important to note that this is not a complete list of potential side effects. If you notice any other effects, it is important to consult your doctor or pharmacist for advice. If you are in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before using this product, make sure to check with your doctor or pharmacist if you have any allergies. Also, if you have skin cuts, infections, or sores, it's important to consult with a healthcare professional before using this cream. Some of the ingredients in this cream, such as preservatives or fragrance, can make your skin more sensitive to the sun. Be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when you're out in the sun. It's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. If you get sunburned or have skin blisters or redness, let your doctor know right away. If you tend to have acne breakouts, be aware that some products may worsen acne. Look for the word non-comedogenic on the label, which means it will not clog pores. And some products may stain or discolor clothing, so it's best to ask your doctor or pharmacist for more details. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to talk to your doctor before using this product. And if you are breastfeeding, it's unknown if this product passes into breast milk, so it's best to consult with your doctor before using this cream, especially if you are applying it to the breast area. It's important to be aware of potential drug interactions with dry skin therapy cream. Certain medications may affect how the cream works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and over-the-counter drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medications while using dry skin therapy cream. If this cream is ingested, it can pose a risk to your health. If you or someone else accidentally ingests it and experiences severe symptoms such as loss of consciousness or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can contact your local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center. When it comes to preventing dry skin, there are a few things you can do. First, try using lukewarm water instead of hot water when you take a bath or shower. It's also a good idea to bathe or shower less often, like every 1 to 2 days, and to keep your baths or showers short. If the air in your home is very dry, using a humidifier can also help. There are many different types of moisturizing products available to help with dry skin. Some of them have fragrances or other ingredients that might bother some people. These products come in different forms, like oils, creams, lotions, or sprays. It's a good idea to talk to your doctor or pharmacist about which product might be best for you. If you forget to use this cream on a regular basis, just use it as soon as you remember. But do not use extra cream or use it more frequently than instructed to make up for the missed dose. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep the cream away from children and pets. Do not store the cream near high heat or open flame, as it is under pressure. Do not puncture or burn the canister. Do not flush the cream down the toilet or pour it into a drain unless instructed. Dispose of the product properly when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.